It is important to keep your asthma under control so that you live a healthy, normal life. Once you've been diagnosed with asthma, it's important to receive the correct medication from your doctor and know how to use it correctly. The most common asthma pump is the Press and Breathe Metered Dose Inhaler, or MDIs. This video will show you how to use your MDI. An MDI inhaler uses a small canister with a mixture of your medicine and a gas or liquid that turns the medicine into a very fine spray as you press on the canister. Most people call this a puff of medicine. Many MDIs have built-in dose counters, so you know how much medicine has been used and how much is left. Before using your inhaler for the first time, or if it has not been used for a week or more, test fire it by pressing down on the canister to release a puff into the air. There are different ways of using an asthma pump, depending on the person's age and capabilities. The most effective way is to use the single breath inhalation technique, which can be done with or without a spacer. Step 1. Shake the inhaler vigorously, remove the cap, and check that the mouthpiece is clean. Step 2. Hold the inhaler between your index finger and thumb, breathe out fully through your mouth. Immediately place the mouthpiece between your teeth, with your lips tightly sealed and your tongue out of the way. Step 3. Tilt your head slightly backwards. Start breathing in slowly through your mouth, while pressing down on the canister to release one dose, while continuing to breathe in slowly, steadily and deeply. Step 4. Remove the inhaler from your mouth. Hold your breath for 10 seconds or for as long as is comfortable. Breathe out slowly, preferably through your nose. If another dose is required, wait for 30 seconds to 1 minute and repeat steps 1 to 4. After use, replace the cap. Rinse your mouth with water after using your inhaler and make sure to spit out after rinsing, as this will prevent you from developing an oral fungal infection. Let's see steps 1 to 4 one more time. Remember to bring your pump with to every single visit so you can demonstrate it again and again to fine-tune any problems.